Welcome to the launch in Limerick, virtually, of our campaign, Patients Deserve Better. My name is Mags Rogers. I'm the Executive Director with the Neurological Alliance of Ireland. The Neurological Alliance is the umbrella of over 30 patient organisations supporting the over 800,000 Irish people living with neurological conditions. And we're delighted that so many of our member organisations are supporting the campaign which we're launching today. I'm delighted to be joined by a number of speakers working and associated with the University Hospital Limerick, and they're going to talk about the particular situation in Limerick Hospital in relation to neurology nurses. As I say, our campaign, Patients Deserve Better, is a nationwide campaign, but we're choosing to do a regional month-by-month focus from today. And for the month of October, we're going to be focused on Limerick Regional Hospital and the shortfall, the significant shortfall in neurology nurses in the hospital there. Just before I introduce our speakers, I'd just like to thank all our audience this morning. Many of our member organisations, we have 15 neurological organisations supporting the campaign this morning, and I'm going to refer to those in a short presentation. I'd also like to thank all our supporters who joined the audience, including some of our elected representatives from Limerick who took time this morning out of their very busy schedule to attend the launch. And certainly we'll be in touch with the whole month of Limerick with local media from today and with local elected representatives, calling on them to support our campaign for more neurology nurses in Limerick and University Hospital Limerick. I'd also like to thank our sponsors, Roche, for sponsoring this campaign. It is very much needed. As I refer to in my presentation shortly, waiting lists in neurology are at their highest ever. There's over 24,000 people waiting for a neurology appointment. And as our Minister for Health, Stephen Donnelly, mentioned over the last few days, nursing is key to reducing waiting lists. So with no further ado, I will introduce our speaker lineup this morning. We're very lucky to have a distinguished lineup of speakers from working directly in the hospital. I would invite people to, if they have any questions, to use both the Q&A and chat functions on the webinar. And I will bring, once the speakers have given their short presentations, I will bring the questions directly to their attention. So I would encourage people, if they have any questions about the campaign or the service in Limerick, to use the chat and Q&A functions. So first of all, this morning, following on from my short presentation, we're going to have Dr. Peter Boers, who is the consultant neurologist in University Hospital Limerick. He's going to speak about the Limerick service and in particular the significant shortfall in neurology nurses that are needed within the Limerick service. We're also joined by Roisin Taylor, clinical nurse specialist in multiple sclerosis in University Hospital Limerick, the only MS nurse carrying a huge workload in Limerick Hospital, and she's going to talk directly about the importance of the nurse specialist in meeting the needs of people with neurological conditions. And then finally, we have actually a patient of both Dr. Boers and Roisin. We have Kevin Saude, who's a local person from Limerick living with MS, living with a neurological condition. He's going to speak about his experience as a patient in Limerick of the Limerick service and the role of the nurse specialist in supporting him to live with the neurological condition. I'm just going to give a brief PowerPoint this morning, which is just going to outline the campaign that we're launching today, Patients Deserve Better, and just give you a little bit more information about it. And then I'm going to move quickly on to our first speaker, Dr. Boers. Okay, so just bear with me while I share my slides this morning. So our campaign is called Patients Deserve Better, and as I mentioned, it's launching nationwide today, but we're focusing for the month of October in Limerick. Just from the get-go, I just want to emphasise the range of organisations, of NAI member organisations that are supporting the campaign this morning. We're delighted with their support. Neurology nurses are critical in the management of all of these neurological conditions. And so our campaign is very relevant to our member organisations, and we're, as I say, we're very glad that they're on board supporting this campaign. Just in terms of a bit of background, outpatient waiting lists in neurology now stand from August of this year at over 23,900 patients. That's a significant increase. If you look back in 2015, waiting lists were around 13,000, and they've gone up to over 23,000 in August of this year. And you see people who've seen a lot of coverage in media of the waiting list issue. Just in terms of neurology, I suppose another critical problem is the number of people waiting for lengthy periods of time. So the number of people waiting more than 18 months has jumped from 355 in 2015 to over 8,000 in 2021. So waiting lists are a critical issue within neurology services, and nurses play a key role, as well as neurologists and the other members of the multidisciplinary team, in reducing those waiting lists and getting this problem under control, because waiting lists are about people waiting for a diagnosis, people waiting to start treatment. All of the in each and every one of the neurological conditions, the sooner that you can intervene, the sooner that you can get your diagnosis and treatment can start. So tackling waiting lists, reducing the time that people need to wait for their appointment, is absolutely critical within neurology services, and I say nurses are a key part of that. A number of studies conducted internationally, but also here within Ireland, in terms of epilepsy nurses, have shown that nurses are key to the efficient running of neurology services. So you see they're finding that nurses make outpatient clinics 40% more effective. That study, the SCOPE study that was carried out on epilepsy nurses right here in Ireland, had a number of other findings also showing that improved management of epilepsy for people who had access to a neurology nurse, and this is applicable across neurological conditions. So in terms of the neurology nurses' role, their critical role in the multidisciplinary team, in terms of medication management, leadership, evidence-based practice, and advice and support to people with neurological conditions. And it is reiterated throughout NICE guidelines for all of the neurological conditions that people with a neurological condition would have access to a neurology nurse. And Roisin is going to speak later on this morning just about what neurology nurses do as part of the neurology team in the management of neurological conditions. Our campaign, Patients Deserve Better, that's launching today, is based on a report that we launched in March 2021, March of this year. We did a national survey of all neurology services back in October last year, and we found shortages of neurology nurses across every neurology centre. The problem was even more acute across regional centres, the likes of Sligo, Waterford, and also Limerick. And that is why we made the decision to kickstart the campaign in Limerick today and focus on Limerick, because the shortfall is even more serious in these regional centres. And just to say that nationally, many patients with neurological conditions, our reason for launching the campaign today, have no access to a nurse specialist. As I say, despite that clear recommendation within the model of care for neurology services and also within NICE guidelines that people with neurological conditions would have access to a nurse specialist. So recent data that was released by a mapping of Parkinson's services throughout Ireland has shown that only 1/5 of people with Parkinson's disease, for example, have access to a nurse specialist. In terms of Limerick and focus, and I say I'm going to only speak briefly on this because the speakers today have a much better knowledge of the local services and of their need. Our concerns are around the high workload for those existing nurses that are in place in Limerick, because we just don't have enough of them. For example, Roisin's post here in Limerick is a standalone nurse for MS. She doesn't have any colleagues, and so therefore they're carrying a very high workload. There isn't cover if that nurse is on leave, and the waiting lists are only growing in terms of the need for that service. Dr. Boers will speak of the shortfall and how it's impacting directly on patients in terms of that there is no nurse for headache in Limerick, and also no nurse for rare neurological conditions, the likes of motor neuron disease, Huntington's disease. And for Huntington's disease in particular, that's a problem that is nationwide, that there is no nurse specialist for Huntington's disease. So I'm just going to conclude there. Really, that's all I'm talking about in terms of the campaign before I come back to our speakers. Just to say that the website for our campaign, Patients Deserve Better, launches this morning. I would encourage all of the listeners to view the website. You can contact your local elected representatives directly using the Take Action Now function on the website, and also join the conversation at Patients Deserve Better. And finally, calling to some of our elected representatives in the audience this morning, just to remind them of that acute shortfall in neurology nursing in Limerick, and that they can expect emails from their constituents this morning in terms of the campaign launching today. And we thank them for their support in advance for the campaign. Okay, I'm just going to stop sharing my screen at this stage, and I just want to introduce our first speaker, Dr. Boers.
Thank you very much, Mags, and thanks very much to the Neurological Alliance of Ireland for deciding to launch this campaign here in Limerick, obviously on behalf of the rest of the country as well. And thank you for asking us all to speak this morning. I thought I'd start out just by giving a very brief history of neurology in Limerick. I think it's of interest not just to the elected representatives who have dialed in, but also to other people who are here, just to know exactly how neurology has developed here in Limerick, what we have at the moment, what works well, and then to talk about where the gaps and shortfalls are and how they might be improved. So some of you may know that neurology first started here in Limerick with Dr. Noel Callahan, neurologist who was based in Cork University Hospital. And he started the neurology service here in Limerick by doing an outreach clinic from Cork. And he did that for many years. He established the neurology outpatient service here. And he also established the clinical neurophysiology service with the EEG department here, which has been running for many years and was very well established. Following from Dr. Callahan, Dr. Sweeney and Dr. Moore then did clinics here in neurology in Limerick. And the first full-time consultant neurologist post was myself in 2008, followed by my colleague, Dr. Schuyler, who was appointed in 2011. So there are two consultants here now in Limerick. The second, Dr. Schuyler, was appointed 10 years ago. We have, as you mentioned, a number of clinical nurse specialists in neurology. The first appointed was Margaret Richardson, whose whose appointment predated me, so she's been here for quite a number of years and has really run an outstanding service for the Parkinson's patients here in Limerick. We then have an epilepsy clinical nurse specialist appointed, and Roisin is a clinical nurse manager too in multiple sclerosis. So we have three of the major subspecialties in neurology covered with nurse specialists. But as you referred to there earlier, we certainly have gaps in the numbers, shortfall in the numbers needed. We have a clinical neurophysiology department here in Limerick. We have a very good EEG service. EEGs are the tests, sometimes referred to as brainwave testing, particularly for patients who have epilepsy, but also EEGs are done for other purposes as well. Again, we just have one EEG technician here, and we certainly could do with expanding those numbers. And more recently, we have a consultant in clinical neurophysiology who visits here from Cork. She comes here several times a month to do electrical tests, nerve conduction studies for patients, for example, who have peripheral neuropathy, motor neuron disease, and other neuromuscular conditions. And again, that's a very welcome development and the start, I hope, of developing that service more. When I first started here, we had no junior doctors in neurology, and gradually we've increased that service so that now that we have several junior doctors, including a specialist training registrar. So we're part of the National Specialist Training Scheme in Neurology. We have quite a number of allied health staff now who work with us in neurology, stroke and neurology for our inpatients, occupational therapy, physiotherapy, speech and language therapy, dietitians, social workers, pharmacy, and clinical psychologists. So we have a good number of allied health staff on the wards. We certainly have gaps in the outpatient service that we could do with building up. And we have a neurology ward, which is co-located with the stroke ward here at UHL on Ward 3B, where we have beds to which neurology patients can be admitted. So as you can see from that very brief history, we've developed the neurology service from really just an outpatient clinic service from Cork into a fully functioning neurology unit. So there are lots of things there that work very well. I guess the key message today is neurology nurses and the role that they play in looking after patients. I guess the thing to remember is neurology nurses are specifically trained both in general neurology, looking after general neurology patients, but also specifically in their own area. So just to give an example of the three that we have, the three services that we cover: Parkinson's, epilepsy, and multiple sclerosis. The vast majority of patients who have those conditions are seen in the outpatient clinics. It's true that some patients with Parkinson's, epilepsy, multiple sclerosis need to be inpatients, and from time to time they'll come in either as an elective patient or an emergency patient, but the vast majority of times they'll be seen in outpatient clinics. Their condition is looked after in the community, and we hope that that's where they stay and they don't need to come into hospital. And the neurology nurses really are the backbone in helping to keep people out of hospital. They run a very important phone service, so people who have questions about symptoms, about complications of their illness, questions about medication, social work forms that they need to fill out, for example, the neurology nurse really is the key to troubleshooting those problems over the phone. So the phone service really is key to what they do. They also run their own clinics, and so they'll see their patients, family, and friends to discuss the condition, to discuss any issues that might come up from time to time. And that's a very important aspect as well in helping to avoid admission and really to educate patients in their condition, educate families and friends in what they might expect and ways that they can help to support patients. So a good example is patients with epilepsy, for example, who might have seizures and require rescue medication. The nurses can teach family and friends to use that rescue medication, again, to keep people out of hospital and to reduce the impact of their epilepsy. They also run outreach clinics, not just based in the hospital, but they might be based, for example, in residential settings such as Lisnagry, or they might go to other towns and hospitals in the University of Limerick Hospitals group, so that the patients don't need to come to the central hospital. They can be seen out in the smaller hospitals or locations near where they live. Again, far more convenient for them, far less traveling, and much easier for patients and their families. So we certainly need nurses in those subspecialties, and as Mags mentioned, Roisin, who works on her own in multiple sclerosis, certainly needs the support of additional nursing staff. The reason why we need, for example, a multiple sclerosis nurse is that over the last number of years, there's been a huge explosion in the treatments available for multiple sclerosis. I sometimes tell the pharmaceutical reps who discuss new medications with me that my neurology textbook as a medical student, which wasn't all that long ago, said that there is no treatment for multiple sclerosis. And that was in my textbook when I was a medical student. And now when you look at the vast array of excellent, very effective treatments available for multiple sclerosis, many of which require lots of pre-medication testing, lots of testing during the medication treatments, we do require nurses to help supervise and walk patients through that whole treatment journey. In addition to nurses, though, we do need support staff for nurses. For example, secretarial support and even office space is a vital component of the nursing service. When a neurology nurse starts, they often are overwhelmed by the administrative side of things, keeping databases of patients, tracking down charts, typing letters. So that's a very important aspect that this secretarial and clerical staff can do to take the workload off the nurses so that they can concentrate on the clinical side of things. And more broadly, of course, in addition to the neurology nurses, there's certainly a deficit in staffing in other areas here in Limerick. Not just at the consultant level. We only have 2 consultants at the moment, although we do have funding for 2 additional consultant posts, which is very welcome. And we hope that in the short term we'll be able to fill those posts. But even so, we'll have a shortfall in staffing in clerical, secretarial, allied health staff. And we hope that as time goes by, we'll be able to address that shortfall as well. So I guess the key message today in relation to neurology nurses is that neurology nurses can support patients with specific neurological disorders. They can specialize in those areas, give patients education in their condition, give them advice about medication, complications, side effects, and also support them through learning about their condition and support family and friends, and keep patients out of hospital, keep them in the community where they wish to be looked after rather than needing to come into hospital, and run the gamut of inpatient stay here. I guess another thing to emphasize is that reports and plans and implementations, we really need to look at implementing reports that are put out and grand plans that become available. And I was just mentioning to Mags earlier that the Call and Hospital report that was published in 2003 mentioned that Limerick needs a long-term total of 3 neurologists. Now that report is obviously very outdated. We need far more than 3 neurologists here, but we still only have 2 neurologists, and that's 18 years after that report came out. So I'd certainly encourage our elected representatives to look at any reports that come out and to implement them as quickly as possible. So thanks very much, Mags, for the opportunity to speak there, and I'll hand back to you.
Thank you so much, Dr. Boers, for giving that insight into the Limerick service. And I suppose is what is welcome, but in a way frustrating, is that there are so many aspects of the service that are working well. It is a vibrant, much needed service, and it could work so much better if it was properly staffed. And I suppose one of the things that our website launching today, patientsdeservebetter.ie, we base our recommendations on the number of nurse specialists on both national and international reports that you've mentioned. The neurology model of care is a number of years old at this stage, but that made clear recommendations for neurology nurse staffing across neurological conditions. If anyone chooses to go onto our website this morning, patientsdeservebetter.ie, they'll see clearly how we've identified the shortfall in neurology nurses throughout Ireland, and the numbers that are needed. We're calling for a national number of 100 neurology nurses to overcome the gaps in staffing nationwide. But as I say, for the month of October, we're focusing very much on the situation in Limerick, where there's a shortfall of at least 8 neurology nurses. I just want to briefly thank the elected representatives and for showing their support. You can see there on the chat function that some of them are already offering their support for the campaign in Limerick today. And we look forward to the support. We'll also be in touch with them throughout the month of October. I just go now to Roisin Taylor, MS nurse working in University Hospital Limerick, and Roisin's going to talk directly about the role of the neurology nurse, the MS nurse, in meeting the people with the needs of people with neurological conditions locally.
Thanks, Mags, and thank you to the Neurological Alliance of Ireland as well today for asking me to speak. Hello everyone, my name is Roisin Taylor. I'm the MS nurse at University Hospital Limerick. I've been in the role for the past year, and I was the first MS nurse to be appointed here at UHL. So prior to this, I would have worked as an infusion nurse at the infusion centre at Nina Hospital, where we would have had people with MS coming into us for their treatments. And I suppose through the years and through the conversations we all had, I knew that the MS community in the Midwest region felt that they were lacking the support that having an MS nurse would provide for them. So MS, or multiple sclerosis, It's a neurological condition which causes damage to the nerves of the brain and the spinal cord, central nervous system. And it's progressive, and it's a lifelong chronic illness. 3 times more common in women than in men. And most people are diagnosed between the ages of 20 to 40 years old. So it's time of life where people are studying, having careers, jobs, having families, looking after elderly parents, symptoms would include mobility and vision problems, fatigue, cognition issues, and pain. And symptoms and rate of progression would vary greatly between each individual. So it's quite an individual disease, and it can be quite unpredictable. So many people with MS then would experience relapses. So they're flare-ups of their symptoms, and they can be quite debilitating, affecting the person's ability to walk, sleep, go about their daily lives, go to work, look after their families. So I suppose, where do I come in and what do I do? Well, I'm the main point of contact for someone with MS in the Midwest region. So I can be directly contacted. And when I started my service a year ago, the first thing I did was I set up telephone advice line. So I can be contacted, people can leave a message and I can get back to them. And I also am contactable via email. So now face-to-face clinics are coming back, so I can see people in clinic as well. I suppose for the last 12 months, a lot of my patient contact would have been via telephone. So the person with MS can contact me themselves, but so can a family member or indeed a carer. And then I work with and I liaise with our neurologists, other hospital doctors, GPs and practice nurses, community nurses, the primary care teams, physio, OT, speech and language, disability services. And I work as well and liaise and link in a lot with the MS Society, MS Ireland, the branch here in Limerick. The main, I suppose, elements of my role would include education and advice, direct support, and admission avoidance. I suppose, firstly, education and advice. People with a new diagnosis of MS, they're referred to me, usually via the neurology clinic, and then I make initial contact with that person. So we can arrange a clinic appointment, or we can arrange a phone appointment. And then I suppose at that stage, the initial, the important thing I need to do is provide education about MS, about relapses, treatments, and I need to find out what the person knows about MS, where they're getting their information, make sure that they're getting it from reliable resources, and direct them. Family members too, and carers, it's important to include them as well in education and support. And I would, welcome the newly diagnosed person to bring a friend, a relative with them to clinic appointments as well. At these appointments, then, it's a good opportunity to assess the person's lifestyle, what support networks they have in place, and discuss other community services, support groups, psychological care that would be available to them. People need to, I suppose, be educated as well regarding treatments, medications, because they're going to want to make a well-informed decision with the consultant when choosing medications. Direct support. So people will reach out to me at various stages of their MS journey. So it's not just when they're newly diagnosed, but also if their disease progresses. They may find their mobility deteriorates, cognition, memory. They might find it difficult to perform the best of their ability at work. Fatigue may take a hold on them. So we can discuss these challenges, and we do it at clinic, over the phone, and we can decide together on a plan of action. Sometimes I refer people onto fatigue management programs or neuro rehab programs. I would have a large cohort as well of women pregnancy, some of the medications are contraindicated during pregnancy. So some ladies will, many people in this cohort, many women will be in contact wondering, fertility, will MS affect my fertility? Can I switch treatment to start a family? Things like that. Side effects, I think Dr. Boers mentioned that as well. Many of the medications will come with side effects. People may be on injections. They might find that it's not suiting them anymore, may want to switch their treatments. So I'd be the person they contact, and I can liaise with Dr. Boersen or Dr. Shaila about that. Admission avoidance, I mentioned that as well. In the past, I suppose, when people had relapses, flare-ups of their MS, the first protocol would have been perhaps the GP, or sometimes they would have gone straight to A&E. So what we do now is they can contact me if it's a thing we feel the person, yes, is having a relapse. And if it's a thing that they will require medication that needs to be given in a hospital setting, we can arrange that the person's brought in as a day case and have their treatment as a day patient. So it means they're not presenting at A&E, they're not, need to be admitted to hospital. So that saves a lot of, I suppose, people just coming to A&E when there's no real need to, and it can be managed as a day patient. And then even apart from just relapses, general everyday symptom management associated with MS, poor sleep patterns, there's bladder and bowel problems, there's, general health promotion. It's quite, varied and wide. These can all be managed at home. The patient doesn't need to go into hospital. They may not need to go to their GP. So again, contacting me, I can liaise with their GP. We can involve community primary care teams, and all the while, it's keeping the patient out of hospital. So I suppose that's kind of an outline of what I do. Now, I guess to a certain extent, I'm still establishing my service, getting it up and running. It has gotten very busy, particularly in the last, I'd say, 6 months. I suppose, for example, around the time of COVID and when the vaccinations came out, there was another influx of, people contacting me in calls, wondering, I have MS, am I more susceptible to getting COVID now? Can I have this vaccine? Will I be okay? Things like that. So in general, the whole service has taken off. It's become very busy. People know I'm here now. I suppose the first few months or whatever, I was, trying to make sure everyone knew I was there and make sure people had my contact details. But now people do know I'm here, and they are using the service. And I suppose my main aim is to help people living with MS with their ongoing general well-being and health and their day-to-day disease management, and just keep them well and to keep them out of hospital. And that's it. Thanks, Megs.
Thank you so much, Roisin. I think that provided a real insight into the day-to-day role of MS nurses and nurse specialists in neurology in general. It's clear that you do so much to support people. Just when you were saying about the supporting people queries about the COVID vaccine, and people pregnant, women or women thinking of getting pregnant, and having that advice and support directly available to them. And then just picking up on your comments of people not needing to go to their GP, people not turning up to A&Es because they have the access to that direct support. And I suppose just thinking about the winter that we're facing into, with concerns already about hospital overcrowding, and as I say, the spiraling waiting lists, it's more important than ever that anything that we can do to reduce that issue in our health system. And as I say, the campaign we're launching today, Patients Deserve Better, is making that critical link between nurse specialists in neurology and tackling the spiraling waiting lists across neurology services. So thank you, Roisin, so much for that presentation. It's great to see already on chat that our local elected representatives in Limerick are getting on board. They're understanding the campaign and the need for it. They're making the link between waiting lists and the need for more nurses and the need to properly resource the Limerick neurology services, which is very welcome. But as I say, I'll reiterate that our campaign is just starting for Limerick today, And throughout the month of October, we will be in touch with all of those elected representatives across Limerick, calling on them to support the campaign. And they can do that in so many ways. Perhaps most effectively is by submitting parliamentary questions, raising this issue, raising the shortfall, and calling on the current Minister of Health to invest properly in nurse specialists across neurology services. So Kevin, I know you've been waiting there patiently. I just want to bring you in now. Kevin, you're a person living locally with MS. You know both of the other speakers. You're a recipient of the neurology services in Limerick, and I invite you to talk about your own personal experience.
Yeah, okay, thanks very much, Mags. When you realize it's your turn to speak, heart pumping, eyes glazing over, I'll try to keep my composure there and just kind of like give a structured, I suppose, view of my experience of the services. But also, I think the key message that I have is that we often think of the person living with the condition, but actually, thanks to my experience, I've seen the effect of the lack of services, lack of information that it has on relatives as well. So not just patients, not just people living with the condition, but also their close relatives. So my name is Kevin, and I've been in Ireland for the past 14 years now. Time flies when you're having fun. I'm a PhD candidate in the politics department in UL. So I teach and research and all that. I thought I was done with the Zoom thing, but I'm glad to be on board here for this launch here today. I've had MS for 6 years, so that means that I've had few interactions with both the neurology department and the MS nurse, especially in the Limerick area. But the thing is that actually I've lived with or around MS all my life. My late mother, Agnes, had a very severe form of MS, which I know it's very rare and it doesn't happen generally, but she died from MS only a couple of months prior to my own diagnosis. My sister as well has MS, and she's 2 years younger than me. She's had it since she's 20 years of age. So my own onset of my symptoms, as I said, just happened literally days after I scattered my mom's ashes. And I think the point here is that I was very, very lucky, in my view, to be in France, because that's there that I received, I think, an amazing care at the very early onset of my illness. And I think my experience actually can help us get some way towards raising awareness around what's lacking here in Ireland from the perspective of the patient. So the irony of the fact that I had MS around me all my life is that actually it remained a complete mystery until I had to deal with it myself. I had MS for the 27 years of my life. And only after 27 years living around MS did I have a clue about what it is. So my background provides me with multiple perspectives as a child who witnessed, and I have to say in bewilderment, deteriorating health of my mom, just misunderstanding over what was happening to my mom who was dealing with MS. And also now as an educated adult, aware that there's severe limitations imposed by what I would qualify as a dysfunctional health system in Ireland. And also the third perspective is that I'm a Frenchman. So I've seen the French side of the care approach and the Irish side. I just want to reiterate though, I'm not sure if you captured that I'm quite critical, but at the same time, I adore my life here in Ireland and I adore you Irish people. But I think there's certain things that need to be discussed here. So as a child, I suffered immensely from that sort of collective lack of understanding of the illness and its effects in this household. My sister, myself, my mom, I think no one really had a clue. And I know it was a couple of years ago, we didn't know that much about MS. There was few medications available, but there was a complete and utter confusion myself as a child when my mom was faced with new symptoms. It took its toll to the extent that I think now, reflecting now that she's not with me anymore, that MS robbed me, and the lack of understanding of MS in the whole household robbed me of that sort of close relationship between the mother and her son, I was quite estranged. I actually even blamed my mother for all those symptoms and not explaining to me what was going on. I actually blamed her. I thought she was making a fuss over all those symptoms. And ultimately, that lack of understanding, that lack of support at the time really robbed me of that closeness, my mum. So fast forward 20 years, and now in France, we've got a regional network of MS nurses who even visit patients at home or available on the phone, and they are referred, so the MS nurses are actually referred directly to the patient, or the patient referred to the MS nurse as soon as the diagnosis is announced by the neurologist. So it's really, the transfer from neurologist to MS nurse as soon as the diagnosis is laid down. So I guess reflecting, the MS nurse is a vital and immediate source of credible, and I really emphasize that, credible information about the illness and the symptoms and how to deal with them. And I think that one effect there is that it alleviates kind of stress, not for the patient, but also for the relatives. And I'm glad to hear that, Roisin, you hold those kind of clinics, which includes not just the patient, but also kids, the children, because they're the ones also living alongside MS. So the second perspective, I'm going to try and kind of be a bit quicker in that. As an adult, I view my story with MS, my life with MS, as a forced cohabitation. And we all know that in households, sometimes communication can be difficult. Well, guess what? With MS and any neurological condition, it's worse. We actually don't speak the same language. I just cannot, I don't have the tools to decipher what's going on sometimes in my body, because my MS is talking and I just don't know how to listen to it. I'm not qualified. I'm not a practitioner. I've no medical background. I do see patterns in the symptoms, but I just wonder sometimes, what the hell now? What is this? What does that mean? And this is where I think, considering neurologists are overbooked, my GP cannot just take my call straight away, Roisin becomes the go-to person. And that's happened before, right? I was arriving for a visit to France last year, and I think I experienced some kind of a relapse. Roisin was the first person I contacted, alongside my GP and my neurologist. So the MS nurse in my mind kind of fits in that kind of like triad: GP, neurologist, MS nurse. And then the MS nurse can make the link between GP and neurologist and me. So really the MS nurse, I understand it now myself as an adult, becomes part and parcel of the whole approach. So I'll just kind of conclude and round it up there, that in my view, services in Ireland, as we know, are abysmal. And I need to emphasize the fact that it would actually, the lack of services for me as a Frenchman living in Ireland would actually be factored in thinking about my future. What do? Do I stay in Ireland? If my illness gets worse, do I stay in Ireland, or do I go back to France where services are better? This would really, really be a heartbreak, because I adore my life here in Ireland. And actually, as a small country like Ireland, with so much solidarity ingrained in your kind of collective psyche there, I would expect a better service, better, wider services, and more widely available. And also very key to my thinking this way is the fact that the lack of rehabilitative structures here in Ireland. That's what I said early on, that my onset to my MS actually happened in France, and I was very lucky. I had a multidisciplinary approach in a small local rehabilitative structure, including neuropsychologist, OT, speech therapist, physiotherapist, psychologist. It was just and it's just a small structure. So it's not a regional thing like Dún Laoghaire here in Ireland. So MS and all other neurological illnesses, to finish, feed on stress, right? If I'm stressed, I'm going to have more symptoms. If I have more or emphasized exacerbated symptoms, I'm more stressed. The household becomes stressed. Kids wonder what their mom or their dad who's living with MS, what the hell is going on? I don't understand. Why don't you give me the same cares as my friend's parents? This was what I was thinking as a child. I was like, why are you a different parent compared to my friends? Explain to me. The MS nurse really can become that person that alleviates stress in the whole household. Explain the symptoms. I very much welcome that Roisin now is in the area and is quickly gaining speed there in the approach. And I think it's better for everyone, not just the patient, but also relatives, the whole society, the whole population, that we ramp up that approach, MS nurse becoming part and parcel of the whole approach. Merci. Thank you very much.
Thank you so much, Kevin. And I think it's intergenerational, what you said this morning about this would have made so much a difference to you if this service had been available. It's not just about the person with MS, it's also the wider family. And I suppose what we're really seeing in the presentations this morning is such a clear insight into how important the neurology nurses, what a part they play in the service, how critical they are to how the service works in supporting the neurologists and supporting the neurology service, in supporting the people living with neurological conditions in the community. And I suppose the message coming from Limerick, if I'm summarising it, it is a service that is working well. Neurology nurses play a critical part in that, but the service as it is unsustainable. The numbers of people requiring the service are increasing year on year. Neurological conditions are associated with our aging population. They're only going to increase, and therefore the need for the neurology service in Limerick and for the need for neurology nurses is increasing. As Dr. Boers says, the core report is already out of date in terms of its recommendations for neurology staffing in Limerick. So I suppose to summarise the messaging from Limerick, it is a service that is working well, but it is a critical shortfall of staff, and neurology nurses are key to that. What we have is a situation where there is one MS nurse carrying an increasing caseload, and then for migraine, a condition that affects over 500,000 people in Ireland, we have no local migraine nurse in Limerick. So I am calling on the elected representative in Limerick, many of whom have joined our campaign this morning, on our member organisation supporting our campaign, and on people living with neurological conditions and their families throughout the Limerick region, to advocate on behalf of their own neurology service in Limerick to support our campaign for increased neurology nurse staffing in Limerick. People who want to take action can visit our website, patientsdeservebetter.ie, which is now live, and I would encourage people to contact their local representatives. We in the Neurological Alliance of Ireland, together with our member organisations, will be pushing this campaign in Limerick throughout the month of October and beyond, highlighting the situation, pointing to the role of nurse specialists in neurology, and calling for direct action to increase neurology nurse staffing within Limerick Regional Hospital. I want to sincerely thank all of our speakers this morning, because I think they have provided a fantastic insight into the Limerick Regional Service. And everyone has spoken very warmly about the service and how well it is working, how well it is serving the needs of patients locally, but with the caveat that more needs to be invested. This service could work so much better if it had the investment it needs. And neurology nurses are a critical part of that. It's not acceptable to have standalone nurses, to have a complete lack of nurses in certain condition areas. I just want to invite Dr. Boers and the other speakers, if they have any final comments this morning, just on top of my summing up there in relation to the campaign, in relation to the local neurology service in Limerick.
Thanks very much, Mags. Could I thank firstly Roisin and Kevin for two fantastic presentations, and Roisin for really giving a great overview, but the practical aspects of what an MS nurse does, and for Kevin really giving us an important insight into how MS affects a person, affects the family, and how the support of the nursing services can really make a difference to the person and to the family. And nursing is not just about medication administration or taking a temperature or a blood pressure. Nursing is a much broader care these days, and the nurse specialists in multiple sclerosis and neurology in general provide a very important backup and a very important frontline service actually to a lot of our patients, helping them to live as full a life as possible with their condition in the community. And as Kevin said, really taking to a large extent the stress out of having a chronic neurological condition. And again, Mags, just to emphasize your point of the number of patients in Ireland who have a neurological disorder, many of whom in some cases are unseen. We may not recognize somebody who has bad migraine headache, for example. We may not recognize somebody who has multiple sclerosis and is living with their condition, but they have symptoms, they have needs, and in many cases, the neurology nurses can really make a difference to how people live their lives. And that's why it's important that that this campaign that you're running is of vital importance. So thanks very much.
Thank you very much, Dr. Boers. And I say it's heartening to see the comments coming in on chat and just this overwhelming support for the campaign, not just in Limerick, but nationally. I just want to reiterate, we're absolutely want to give Limerick its due. We are focusing for the month of October on briefing local representatives in Limerick, on briefing local media from today in relation to the neurology nurse shortfall and calling for investment in neurology nurses. But just to remind people, I suppose, wondering when is this campaign going to come to me? When is this going to come to my local neurology centre around the country? We are starting in Limerick this October for the month of October, and then we will be moving on month by month to the other neurology services around the country. But I would ask everyone in Limerick and its surrounding regions that avail of the services of the Neurology Hospital in Limerick. Everyone knows someone who is affected by neurological conditions like Parkinson's disease, epilepsy, migraine, multiple sclerosis, to come out and take action on behalf of their local neurology centre, to visit our website, patientsdeservebetter.ie, where you can write to your local TD. They're all listed on the website, and one email goes to all of them and draws attention to this shortfall and calls for direct action to invest in neurology nurses. And to sum up, neurology nurses play a critical role in meeting the needs of people with neurological conditions, the over 800,000 Irish people living with neurological conditions. They are also key to the effective running of neurology services, to tackling our waiting lists, which are at their highest ever in terms of neurology services. They're critical to keeping people, as Roisin said so clearly, out of accident and emergency departments. And as we're facing into our post-COVID winter with concern of hospital overcrowding and increasing waiting lists, it's more important than ever that we invest in anything that can address that. And neurology nurses are key to improving the effective running of neurology services throughout Ireland. I want to sincerely thank all of our speakers who have given such a fantastic insight. I've learned so much about the neurology services in University Hospital Limerick. I've learned so much about the role of the neurology nurse, and then from Kevin's direct testimony, just how important that is. Sometimes when you see numbers and staffing, it's just a number. I think Kevin's testimony this morning has reiterated just how important that is to people living with these conditions nationwide throughout Ireland. So once again, my thanks to all of our speakers this morning. I also want to thank all of the people who've come on to the webinar this morning to support the campaign. We look forward to your support throughout October on patientsdeservebetter.ie. And once again, really calling out for action from the people of Limerick to support this campaign from today.